moment of entertainment and enlightenment.
We hope you'll tune in.
For more information about A Moment of Science or to download our latest podcasts, visit us at amomentofscience.org.
Listen weekday afternoons at 5:45 on KSJE.
This
Good morning, everyone. I'm Megan Cullip, along here with Scott Micklin.
Good morning. It's Monday, July the 6th.
Yeah, that was like
What?
slowly clicking,
It was there.
right?
I was pacing myself.
Okay.
That's what I was doing.
Got it.
It didn't come across that way?
No, I mean, I was like, yeah, what day is it?
Right.
So I'm glad you do that
Here
part.
we are. Exactly. But great to have everyone back with us for our local information program about COVID-19. We've got some great guests lined up today who we're going to get to in just a moment, and also some other facts, figures, information, and what we're doing every week.
That's right.
Mondays and Thursdays.
Keeping the peeps informed.
There you are, peeps.
Peeps.
She's talking to you.
I'm talking to all of you.
Okay.
It's
Some of our peeps are fuzzier than others, I guess, is what I would
or
say.
more sugary.
Maybe, right? Those peeps.
It's language for people.
Okay. I know. That's why you're on the show. You add that je ne sais quoi to the program.
Oh, I'm outstanding in my field.
You are that too. That's right. Exactly. So anyway, let's get right to our first guest, shall we?
Yeah.
Because he is called in.
He's
He
ready.
is ready to go, and
Okay.
we're so glad to have him on the program. It's San Juan County Emergency Manager Mike Mestis who is joining us on the telephone this morning. Mike Mestis, good morning.
Hey, good morning, Scott. Good morning, Megan.
Good morning.
Having me this morning.
Absolutely. So let's hop right to it, Mike. What is the update on the current COVID and non-COVID? What's happening out in the world of emergency management these days?
Well, as you know, we had the 4th of July weekend. It was a busy weekend, and kudos to San Juan County Fire, who responded to tons of calls. I don't know what the final count was, and of course Farmington Fire as well. But on the bigger note, San Juan County Fire had a 100-acre brush/forest fire in the Cox Canyon area on Saturday. You may have seen the big smoke header to the north by the state line, and air tankers came in to surround that with fire retardant, and BLM came in and they transferred that to them by Sunday, and by this morning I think they have that totally under control, and doing mop-up. So busy weekend, as we can all tell, with the 4th of July.
Very good. And did you guys get a read on how people did with the 4th of July celebrations? We know the public health order has been extended at least through July 15th. So you guys have a read on how we're all doing collectively on that?
Yeah, just on the COVID front, of course, July 1st, the governor came out with the new press conference, and she held us back on phase 2, and she put us on temporary hold, and I think she called it a pause, and so she's pausing us to July 15th to see if we're going to do any better. And of course, we're doing really well in San Juan County. Our deaths are down. We didn't have any deaths on Sunday. I think we had one on Saturday, because I have to do that report every day. So the deaths are low, but the numbers continue to rise. Of course, they're doing a lot more testing, but they're not overextended or over-exaggerated numbers like in the 70s. I think we're down in the 20s and 30s. But of course, the numbers continue to rise, and that's why she's trying to protect. Of course, I gotta back her up, working in the public health and emergency management field, just trying to protect the public by asking, yes, going back to your original question, by wearing masks and protecting yourself.
Great, thank you, Mike. And of course, part of the governor's health order was that mandatory face covering whenever we're out in public. And again, when I've been out wearing mine, I see kind of mixed results. I think the majority of folks that I encounter seem to be wearing their masks, at least in Farmington and San Juan County. But of course, it should be everybody, according to the governor's health order. And I know you and your department's been trying to spread that word as well, right?
Yeah, and if you need a mask, all you have to do is call. I know a lot of the stores, since it is a requirement. Certainly here at the county, if you come into the county, you need a mask, we'll give you one. Again, yeah, it's just asking the public to take care of yourself and mind your neighbor and your family by wearing that mask. And you never know. You never know who's got it, who's near you, or if you've got it. We have a lot of asymptomatic people running around not even knowing that they have it. So this in turn protects yourself or other people from yourself as well.
So, we were talking on the show, Scott and I, that I got tested 2 weeks ago, and it was a throat swab, but I want to hear about updates on testing, including if there is a uniform test that we're using. So, are we using throat swab, nasal, and nasal pharynx, or are they just throat swabs now? Does it just depend on what you pick up as far as resources goes, and where are we testing these days?
Yeah, it's so it varies on location, whether you're at the hospital or if you're at the convenient testing centers by the Department of Health. And that's probably where you went, correct, Megan? You went to one of the Department of Health testing clinics?
I went to San Juan College.
Okay, so that's the Department of Health testing clinics. They do that swab. And so those testings are actually going on weekly. The Department of Health is hosting those testing clinics Monday, Tuesday, Wednesday and Thursday of this week. Today, they're doing them at Judy Nelson School in Kirtland, starting at 7 this morning. San Juan College tomorrow morning, starting at 7. And of course, San Juan College from 6 to 7 p.m. So they're doing a duel tomorrow to try to get people getting off of work. Judy Nelson again on Wednesday, and then San Juan College again on Thursday. So again, wanting to try to test as many people as they can to ensure that we're getting a good, accurate count of who has it and who doesn't here in San Juan County.
Right. And again, Mike Mestis, we know, the testing only is kind of a snapshot in time, right? So if, people could be tested multiple times. It's not like you only can be tested once and feel protected, because it's only telling you if you've been infected ahead of the test, right? And so if you've been out and about in the last couple of weeks, you may need to be tested again or want to be tested again. And these things are available for everybody, correct? They're pretty much available to anyone who wants them now.
Yeah, the testing is absolutely free. Again, some of the questions that we get told are they testing for antibodies? No, they're just testing for positive, non-positive for COVID. and like you said, Scott, just because you're negative now doesn't mean 2 weeks from now you're not positive. Especially if you start feeling symptoms, that would be the clue to go get tested again, and it's for your own peace of mind. So yeah, getting back to, you could be asymptomatic, no symptoms at all, but you are positive and you're running around town. So there is that possibility of asymptomatic, symptomatic.
Sure. Yeah, we keep hearing that. So we have a question on the screen. Who should get tested? I do not hear a clear message, and I think the clear message is anybody who wants one, everybody, especially since we've discovered so much about asymptomatic spread. So I want to switch gears a bit. Sorry.
I was just going to say, for peace of mind, I think if you're concerned,
Sure.
you could get tested and go to one of these events that has been set up throughout the county to avail yourself of one of these tests. And for peace of mind, if you want to know, that would help.
Sure, peace of mind and stopping the community spread, I think. I mean, it used to be restricted to first responders and symptomatic people, but now we have more. So
Right.
That's good news.
Exactly.
I want to switch gears a bit to congregational settings like nursing homes and the detention center. What are the updates in those locales?
Okay, yeah, some of the good news that's coming out of the nursing homes, we're not getting a lot of positives or high numbers in those facilities anymore. We had brought in the Department of Health, we brought in some assessment teams, and quite frankly, the nursing homes are doing a great job in keeping that infection out or spread out of their facilities. So I think it's been days since we've even had a nursing home death, so the nursing homes are doing a great job. On the other side, we've kept it out of the detention centers for a long time, but 2 weeks ago we had some prisoners transferred that were tested, and again, those prisoners were asymptomatic, which means that they don't have any symptoms, but they are a positive test. So coming back to tracing the detention center here, they found that they had over 80 the first time asymptomatic detainees at the detention center. So with additional testing, the last count was 118 detainees. 117, though, are asymptomatic with one jail guard. So that's what's going on there. So 118 out of a 314 population census there at the detention center were positive. So what do? We keep those prisoners isolated so that the others don't get near those, and they don't get engaged with that population. They have different pods there. I don't know, Scott, maybe from Leadership San Juan, you did a tour there. They have different pods where they can keep these detainees isolated and keep the negatives away from the positives so that it can run its course.
Right, and that's an important thing, and I think that's a good point to make. That, I mean, for a long time when other outbreaks were happening at detention centers around the state, ours was not, and as you mentioned, now we do have these positive cases, but most are asymptomatic, and so the detention center is trying to keep those folks separate from the rest of the population and to keep an eye on things. Mike, you mentioned the fires early from 4th of July, and I just wanted to mention, that's another thing when you're working with a group of firefighters. How do you stay separate when you are fighting these fires? Or I know they have breathing apparatus and things like that, but I imagine all that stuff has to be then cleaned pretty well and put back on the shelf ready for the next fire. But you can't stop going out as a group of firefighters just because of a pandemic, can you?
No, not at all. And it was a very busy weekend for them. Just a quick shout out to McGee Park for allowing the fireworks for the public to be shot out there. I heard that was a great success for them out there. I saw pictures of the dumpsters full of people cleaning up and after themselves, and the dumpsters were full. But yeah, so that kept a lot of the fires from spreading into the neighborhoods. But yeah, the firefighters have breathing apparatuses, and when they go on medical calls, of course, it's mandatory mask and keeping things clean when they get back to the station. And incidentally, on that forest fire, they are required to wear masks when they're up there. Whether it's the bandanas or so on and so forth, they have to have some type of face coverings when they're within their groups back at camp or when they're socializing.
That makes sense. Well, Mike, we appreciate your time this morning and calling in to give us an update. You're still on, is it a weekly call from the state to get updates from them on what's going on?
Yeah, it's a daily call.
Daily, pardon me.
With them. But it's day 130. I guess I didn't mention that for San Juan County. And we talk daily with the Emergency Operations Center. We do our situation reports to them, telling them what's going on in San Juan County. But, things continue. We await what's going to happen on July 15th on the new phase. Hopefully San Juan County is doing their due diligence as well as the state of New Mexico. And they're just trying to keep it from ramping back up, Scott, Megan, as Arizona and Texas is doing right now. Things are ramping up there. And hopefully we don't get that second wave here. But if we do, we're prepared for it. We continue with our protective equipment for our first responders and our nursing homes, as well as our dentists now are getting back to work. So we're helping them out with the protective equipment as well. So yeah, continuing to fight the fight, and we're all in this together, and we hope to get rid of this soon.
Right. Well, and again, we just need to look at our neighbors to the east and west, Arizona and Texas, to kind of see some of the things, and they're going backwards a little bit of having to shut some things back down because of their numbers, and it's quite possible that the governor might order things shut back down if our numbers don't stay better, get better, those types of things, and that's what you all are talking about in those calls every day, I imagine.
That is correct, and she wants to open up. She wants the communities to thrive, but we don't want to step back as well, and I understand that. I understand where she's coming from.
Exactly. Well, we appreciate where you're coming from, Mike Messis. Thanks for calling in this morning.
Thank you, and thanks for having me, and I'm happy to give you guys an update, and you guys have a good week.
All right, we
You
sure
too.
will. Thank you very much. That is Mike Mestis. He is the director of the San Juan County Office of Emergency Management. Again, our guest this morning, and great information, and as you mentioned, a daily phone call with folks from around the state to kind of get a grip on what's going on.
Right. And this is, this is sort of COVID related, where he mentioned that they opened McGee Park to shoot. You could shoot off whatever fireworks you want.
Right.
And I was like, that's true emergency management. That's pretty proactive.
Right.
People are still going to shoot off fireworks. Let's just give them a parking lot to do it.
Right.
Love it.
Something that they do.
Super pragmatic.
They do that every year.
Oh, it's not just fire years?
No, well,
I guess it's always a fire hazard here. Yeah,
it really
exactly.
is always a fire year, so that's true.
Okay.
But some video that was posted from that area, there were a lot of people taking advantage of that, which is great because, as Mike said, that was the point. So folks don't shoot them off maybe in a neighborhood where it could maybe catch something
your
on
neighbor's
fire,
grass on fire, or
and you
whatever,
don't want
yeah.
that. So we appreciate all the people that went out and did that safely. So and again, thanks to McGee Park, thanks to the county who owns McGee Park for making that available to folks.
Yeah.
It was a great thing. So,
Yeah.
so there you go.
Proactive emergency management. Love it.
Exactly. And again, Mike was mentioning the testing, and we want to talk a little bit about that this week from the Department of Health. And again, we appreciate their information. So today, there was testing this morning out in Kirtland, again at Judy Nelson School. Tomorrow, as Mike mentioned, there is an event in the morning and the evening here at San Juan College. So again, arrive by 7 a.m. or the other option is 6 to 7 p.m. here at San Juan College for free testing. Wednesday again in the morning in Kirtland at Judy Nelson School. Arrive by 7 a.m. And this Thursday morning at San Juan College again in Farmington, 7 a.m. Arrive by 7 a.m. There's the information there from the New Mexico Health Department, nmhealth.org. You can register ahead of time. They're asking that you wear a mask to the event. That kind of should go without saying, but please
and
do.
yet here we are saying it over
Yes.
and over again. So please do it.
So there you go.
Yeah.
And there's a QR code on the poster for our video viewers that you can point your phone at that, and that will take you to the website to get registered for the event that you want to go to get tested.
Love it.
And that's so they know who you are when you're there, because since you've been tested, right? You've gone through all that.
Oh, yeah. So you pre-register, and then a volunteer comes up to your car, writes your name and, chalk on your window so that by the time you get to the point, they already have your, packet, the whatever, biohazardous material bag
Nice.
ready for you.
Right, okay.
So
But
it's
keeps it
very efficient.
Right.
So
because
register beforehand.
There's usually a line of cars, right? I mean,
Right.
usually it's a little bit of a wait to get
Right, but
tested.
they've really perfected, they're like talking into walkie-talkies. We have Call Up Megan coming up so that they have the bag ready.
Nice.
Yeah, so pre-register. For
I would
sure.
think they already have a file on you.
Lots of files on me
Maybe that's
in
what
this country. Yeah.
Just saying.
It's a transatlantic issue. Yeah, exactly. That's
you
very
go.
good. Numbers?
What else you got?
Are we
Numbers?
go-
I'm
okay.
getting numbers. Yes.
Okay, because I have the national
What do you
numbers.
got? Okay.
So
All right, let's go with that.
from the Johns Hopkins University dashboard, as of Sunday night, 2,888,586. Whew, it's hard to say. So
Right.
we'll just say 2.8 million roughly.
Thank you. Right.
Cases of COVID-19 have been reported in the U.S., which 129,947 deaths have been attributed to the virus, which just want to do a little side note because our local librarian, Karen McFeeters, I think provided a really helpful image last night on her Facebook page referencing this number where we're almost at 130,000. In fact, it wouldn't be surprising if we were there by tomorrow. And she made mention that our public library has 130,000 titles.
Wow.
So it was
That
a
puts
very
us into
helpful
perspective.
It
Think of that whole
does.
building and the number
Right.
of titles, number of books
Right.
equals the numbers of people.
Right. So if you walked into our library, it would be completely empty.
Yeah.
And that's the number of people. That's
Yes.
just a
Yeah.
helpful image, I think. So
I think too, because when you get these numbers that are so large, it's hard to kind of wrap your
Yeah, we
mind
start
around,
losing,
around
yeah.
them, and so that's a little better number.
it is.
So, and of course, the population of our county is less than that.
Yeah, way less than that.
Well, not
isn't
way.
It? What?
Maybe 120,000.
Oh, okay.
You know.
I'm thinking town.
Right, Farmington's
Okay,
about 45,
county,
but Salmon
okay.
County's about 100.
Right.
And maybe we'll find out if everyone fills out the census this year. Everybody, but
That's
yeah,
right.
it's,
That's like 5 major American public universities
Yeah,
would be completely wiped out.
yeah.
So anyway.
There you go. All right, numbers on our website, ksje.com. Again, we kind of keep track of them that are coming in from all different sources, the state, the county, and others. The state numbers here from Sunday, of course, there were 203 new cases yesterday for a total of 13,256. Of those, San Juan County had 28. For a total of 2,542. Notable, I think, is no additional deaths reported on Sunday, so that number stays at 513, and so there were no new deaths in San Juan County, and there were 15 new recoveries reported on Sunday for a total of 5,860 across our state. So I think that's notable.
It is notable. Yeah, and of course we just heard Mike Messis mention that cases are rising, but deaths are flattening out.
Right.
But the cases piece, right, is of course what we've been afraid of, which is overwhelming the healthcare system.
Right.
So I think I just read a report this morning from the Texas Public Radio that San Antonio now only has 10% of their beds open. So their hospitals just
Right.
filled up almost overnight.
Wow.
So-
I think Houston was having an issue, too, with
Yes.
capacity in Texas as well. So, again, that's part of the thing. I think part of Mike's call and part of, I think the hospital has a call.
Mm-hmm.
You know, everybody's trying to report in as to how things are looking. Now, again, not all these new cases necessarily mean that these people are hospitalized.
Correct.
So,
Right.
that's notable.
Correct.
So there were 203 hospitalizations.
I wonder if we can find like the specific number of hospitalizations.
I believe the hospital does update that maybe weekly.
That's true. And they
So-
give us that number weekly too.
They do.
Okay.
So they've been really good about doing that. As we scroll down, we can see again other stories, the details on the state numbers, the details on the Navajo Nation numbers again to point out 71 new cases. And this was as of, I think, Saturday. They were a little delayed in getting the numbers out on Sunday, but they're at 7,804 on the reservation number of 2 additional deaths. And they have 5,543 recoveries on the Navajo Nation as well. And then, of course, the detention center story there that Mike mentioned about the additional positive cases there. And we talked to Mike Stark last week a little bit about that, so
Right.
got
the
that
mics.
information. The mics have been on the show. Exactly. So we're waiting for our next guest.
Cool. So you want some interesting factoids?
Always want interesting factoids because I know that's why you have them.
Yes,
To
it's
share,
just because you
to share
want
with
them.
me
Right.
and our audience.
Right, correct.
Yes.
So I heard a report this morning about testing pools. So Anthony Fauci mentioned this within the past couple of weeks about this concept that is a way to be economical with our testing resources. So I don't know what the fancy word for it is, but basically whatever you need to perform a test and run it for results. And so the idea with testing pools is you get 10 people, you test them all, like you group them in 10s, right? So you test all 10 of them, and you just run that once. And then if it comes up negative, you assume all 10 were negative, but if it comes up positive, of course, you have to retest them individually. Does that make sense?
I'm sure it did. I'm sure it did.
Would you like me to repeat it? No.
Yeah.
So the idea is maybe when schools go back in the fall, right? You test 10 kids, you run that as one group.
Okay.
Comes back negative, all kids are negative, right? But it comes out positive, you got to retest them individually. So it's supposed to be an easy way to save resources.
I get that.
Yeah.
Right. And if you've got this group of kids who are going to be a group of kids, like in their
right,
class.
maybe they're in a class, right.
And so they're not going to separate around the school. That's part of it too, right? So if you know that group is negative, then they're good to go.
Right. And that would probably work better in like elementary settings or something, right, where there's less fraternizing. But yeah, I thought so it's called testing pools. So I thought that was really quite interesting.
That is interesting. So, and again, we are learning more and more about this virus. There was stories about how it may linger in the air. We've talked about that before.
Right. Difference between droplets and aerosolizing.
Right. Because you mentioned walking, if you walk maybe side by side someone and not behind someone.
Right. That's better.
Yeah.
Yeah.
So we're learning more again about this. And so I know it's frustrating for folks who maybe watch the news or watch posts on social media. And one day the posts say one thing, and the other day the posts maybe say something a little bit different, and it's really hard to know what to believe and what to follow when the information is changing.
Correct. I think there are some reliable news sources.
There are.
And there's a lot of unreliable news sources. But
True.
So I think
but even those reliable sources are saying, now the doctor's saying this, and now the doctors are saying this. So
right, because there's constant research. On this novel virus, right? I mean, one of the most interesting things I also read, this was in Wired magazine, was about, so in the 90s we mapped the human genome, that was under President Bill Clinton, and that was a huge landmark scientific discovery. They mapped the complete human genome. Now with that technology, they've actually mapped this virus, and so they can watch it mutate real time.
Right. So that's cool.
So cool.
Yeah.
I want a seat in that. I want to look through plexiglass to see how that looks.
Right.
It's probably not I probably wouldn't know what was going on is really the reality of it, but still.
Right.
It'd be interesting.
That would be good. That'd be good. Well, I've not heard from our other guest, so I don't know if she's going to be available today.
Maybe not.
Maybe something came up. But we were going to we'll try to book her for Thursday.
Sure. We were going to talk about masks.
We were. Mm-hmm. Because, again, as they talk about maybe schools reopening, I think that was the other demand that maybe more masks could be available for school personnel, maybe even students. So if and when the schools do open, they have a supply of masks at the ready. Right.
You've seen the face shields, though, right? Like in Japan, the school children are wearing full-on face shields.
Right. Okay.
Which is that's
work.
That's up in the game.
That could work.
I think it's supposed to work better. I don't know.
Yeah. So, but there you go. But anyway, so we will rebook our guest for Thursday.
Great.
And see if we can do that. But I think we're about wrapping up for today.
Yeah.
If you have other questions, folks, you can give us a quick call, or you can write them on our Facebook page, and we will try to answer them and try to get them to our guests to answer too when they have called in.
Great.
So there you go. We're done.
Well, I mean, that's pretty. I mean, that was a slew of interesting facts.
It was a slew. I'm informed. I learned something this morning.
You're welcome.
That you have a file. So there you go.
I have files.
You do.
I have files across the nation.
You do.
I do.
I think that's true. Anyway, well, thank you for joining us, everybody, for our local information program here on KSJE. And again, thanks to our radio partner, KNMI. This will be broadcast on their radio station at noon today, 88.9, and on KSJE radio today, 90.9 FM and 103.3 FM at 5:06 p.m. But until Thursday at 9 a.m. live on Facebook and YouTube, we will see you then. Have a good morning.